As the awareness on testicular cancer continues globally to promote self-examination in a bid to help capture this cancer at an early stage, doctors are calling for vigilance among men between the ages of 15 and 35 years who are said to be at risk of developing this type of cancer. Doctors say early diagnosis leads to better treatment and care, hence the need for self-awareness. The corridors of this facility might not be new to 24-year-old Josie Ibrahim from Nakuru County. 4 years ago, he walked into this facility, oblivious of the diagnosis that was to come, following symptoms that gave him sleepless nights. However, today, his visits are only meant to check his progress.
Nilikuwa naugua mwili, nahisi vitu tofauti, kuumwa na kichwa, kutapika, lose weight. And unfortunately, najua wanaume wanapougua wakati mwingine hawasemi, ni wasiri sana. So hiyo mwaka mzima nilikuwa mgonjwa sana, sikuwa najihisi vizuri. So ilipofika 2018 hapo mwisho, Oktoba, nilikuwa na uvimbe ambao ulikuwa unanipatia uchungu mwingi sana. So hapo ndipo niliongea na rafiki yangu mmoja anaitwa Zaidi Kim. Nikamwambia, bro, mimi sihisi vizuri na niko na uvimbe.
And just like any other patient, the severity of the pain he experienced saw him consult a doctor on the possible cause of the pain on his scrotum region that caused him untold suffering.
After kumuona, akaniangalia na akasuggest kwamba tufanye upasuaji siku ambayo inafuata. Na hapo tukafanya malipo na nikafanya upasuaji. Nikatolewa ule uvimbe, ulikuwa mkubwa. 271 grams, hiyo ni kama nyama quarter, unajua. So ilikuwa mzito sana. So nilipotolewa ile uvimbe, mimi nikajua story imedai, story imeisha. Ile uvimbe ukatumwa Nairobi, Aga Khan Hospital kwenda kupimwa.
Relieved that all was well following the successful surgery, the laboratory test results to determine the doctor's fears marked the beginning of a painful and expensive cancer treatment journey for Josie, whose results came back indicating that he had testicular cancer.
Nikashindwa mambo, mimi niko na cancer, nimetoa wapi? Na unajua, I was living a very simple life, a very comfortable life, not an expensive life. Unajua watu wanasema kwamba saratani ni lifestyle. Vitu vingi vinasema kwa mitandao. Kapo ile barua nikaambiwa sasa unafaa kuanza kitu kinaitwa chemotherapy treatment. Wakaniandikia dawa, the plan, they came, wakakuja na plan ya treatment. Wakaniandikia, wakafanya down payment ya cost. I think ilikuwa na cost, ilikuwa pesa nyingi sana. Na wakaniambia kwamba treatment unafaa uanze next week, Monday. Ile pesa ilikuwa kibao, bro. Kwa sababu hata pesa ya surgery yenyewe nilichangiwa, unajua, kwa pesa mingi sana. Na najua muziki Kenya venye iko, wasanii wanateseka sana. Sio eti muziki nalipa pia. Mimi nikarudi Nairobi, kafunga story. Sema sasa Mungu umeleta, nipiganie.
Josie is among men between the age of 15 and 35 years who are diagnosed with this type of cancer every year, contributing to an incidence of 1% of all types of cancers in men worldwide, as explained by Dr. Siwili Smith, an oncologist at the Nakuru Level 5 Hospital.
Testicular cancer is a type of cancer that mainly occurs in men. Worldwide incidence is approximated to be around 1% of all cancers in men. In Kenya, it's not a very common malignancy. And if we look at the Global Can 2020 data sheet, you realize that testicular cancer ranks 19th in terms of incidence, with around 35 new cancer cases recorded in the year 2020 and around 12 deaths. So out of around over 42,000 cases, new cancer cases recorded in Kenya last year, only 35 were testicular cancers. That accounts for 0.0008% of all cancers diagnosed in the country. So not a very huge burden, but yeah, it does occur, and it ranks 19th of all cancers diagnosed in Kenya.
Dr. Mburugu Gitobo, a consultant urologist, explains that some of the symptoms that one should look out for include a painless mass in the scrotum that most people present with.
People might present with a bit of pain or heaviness in the scrotum because the mass has grown very fast and has probably caused a bleed within the mass, or has caused a very rapid expansion of the capsule of the testicle, so it might be painful, but by and large, most of them are painless.
He says the diagnosis of patients presenting with this disease varies depending on how advanced the disease is.
Picture really, some will come early, some will come late.
Since testicular cancer is a rare cancer, making a diagnosis involves a process, and these include a physical examination, radiology investigations, and lab tests.
Once a patient complains of a lump in the testicle, and they are referred to a doctor who will confirm that the lump is there. And in your physical examination of the patient, as well as in his history, you will find out how long it has been, whether it's painful or painless, whether there are other symptoms showing that it has spread or not, such as shortness of breath or back pain. And when you examine him, you'll confirm that there's a lump. The lump has to be on the testicle. Remember, the scrotum contains 2 testes. And it also contains the epididymis, the tube that carries sperm from the testicle. And it also contains a few other contents like vessels and so on. So the clinician confirms that the swelling is actually on the testes. There are a lot of other lumps that happen on the epididymis. So those are not very worrying because most of them are benign. But if the lump is actually on the testicle itself, or involves both the testicle as well as the epididymis, then it behoves you to do an ultrasound scan. The ultrasound scan is what we use for diagnosing testicular cancer. So if it shows you a mass within the substance of the testicle, which has a blood supply, then that is a testicular cancer until proven otherwise.
Whereas pregnancy test kits detect a hormone in the blood and urine produced by developing placenta to determine whether one is pregnant or not, Dr. Mburugu says the same kit can turn positive if used by someone who has testicular cancer because the cancer produces the same hormone that the kit detects.
Which detects the earliest pregnancies within a few days of conception will be a blood test. A chemical that is produced by the placenta once you become pregnant, called human chorionic gonadotropin, or beta HCG. And this chemical is found in both blood and urine.
He, however, notes that not all cancers will produce this kind of hormone, though one who has undergone treatment can use the kit as an indicator of the cancer's response to treatment.
If this particular tumor is producing beta HCG, it will be useful in following up the response to treatment. Because if you treat him both surgically and with radiotherapy or chemotherapy or both, and it is successful, then the levels should go to 0. But if during surveillance, because when you have cancer, we do not declare you cured immediately after we treat you, even though there is no sign of the disease. We have to periodically do tests, both blood tests for these chemicals if they were there to begin with, or imaging via CT scans of the abdomen. So if somewhere along the line of this surveillance, as it's called, the chemical shows up again in your blood, then it shows that the cancer has come back. So it's used for follow-up of treatment.
As much as the treatment options for testicular cancer varies depending on the stage of the disease, Dr. Mburugu warns that the treatment can lead to infertility among the patients.
Sometimes subfertility or infertility is one of the risk factors for testicular cancer in young men because they may have abnormalities that predispose them to both being subfertile or infertile, as well as predispose them to the testicular cancer. However, not all of them will have this. It's just a small percentage will have either subfertility or infertility.
And since treatment options like chemotherapy and radiotherapy affects one's sperm production, he advises men of reproductive age to opt for sperm storage before starting treatment.
This disease is quite survivable for them to store their sperm before treatment if they are of childbearing age, because later on they may be rendered infertile by the treatments.
For most people diagnosed with cancer, the cost of treatment is often a factor that cannot be ignored. However, Dr. Mburugu says this is contributed by the fact that the treatment involves a multidisciplinary approach.
So if a patient is going to undergo surgery, then an adjuvant chemotherapy, this patient's cost of treatment is going to be less compared to one who will need the surgery, then chemotherapy, and in addition, radiation therapy. So the treatment varies depending on the scope of treatment required, and number two, according to the regimen they are going to get.
Cancer treatment for any cancer is expensive because, number one, the tests, the diagnostic tests, and number two, the surveillance tests. Like we said, if you come with testicular cancer and we treat you, let's say we remove the testicle, and it's not, the tests say that it has not spread. That's not the end of the story. You have to follow up with both laboratory tests for the 3 chemicals that we talked about, as well as CT scans of the abdomen and chest every so often, maybe every 6 months or every 12 months, depending on the stage of the disease and how far he is from the diagnosis.
Men between the ages of 15 and 35 years should develop a culture of self-examination to help capture the cancer at an early stage. One challenge with testicular cancer is that most men are not open to discussing their private organs or problems, if any. As a result, the positive diagnoses are made late. Yet, this type of cancer is curable. Gloria Milimu,